COVID-19's impact on life in Singapore has been captured through the lens, and it tells us just how much our lives have changed. 7 individuals worked with the National Museum to document the circuit breaker last year, as well as the months that followed, for a new exhibition. The visual record includes shots from across society, including in places that were out of bounds to the public. They tell the stories of people ranging from frontline healthcare staff in the COVID-19 wards to essential workers who kept Singapore going. The exhibition also shows how routines in the community changed at the height of the pandemic. And all this will be on display at the National Museum from this Saturday. And for more, we're joined by co-curator Miriam and photographer Bob Lee. Thank you both for joining us this evening. Bob, I'll come to you first. You got the chance to document the lives of 2 healthcare workers, one of whom works in a COVID ward. Describe the experience to us and what you saw and what the mood was like in that environment.
I used to be a photojournalist for about 10 years, and then I quit the job and then starting out my own photo studios. But when I get the chance to do the photo shoot again, it's very a very good experience. And going into the pandemic ward, the emergency departments, and even before shooting, start the shooting, we need to actually do the the mask fit, and that's totally a new experience to me. And of course, I need to wear the full PPE when I go into the ward with the nurses when capturing them in actions. I think, it's a very good experience.
So, Bob, explain a bit about what you mean when you describe it as a good experience. What insights did you learn? Yeah,
of course. When I entered the room, looking at the nurses at work is not. I mean, I should the whole series. Actually, in fact, I did a few series, nurses, and also do another series about unsung, called the unsung hero, which is the essential workers at work. But when I captured the nurses at work, is when I realized that they are not. To them, it's not just they are not just essential workers, but they are taking their own risk to be in the hospitals and in the wards, in the emergency departments, because it's no longer just a job. It's more than just a 8 hours or 12 hours shift to them. And definitely when I go in, especially when I went into the emergency ward at the temporary tent, you see the patients. A lot of patients. I mean, some of them can go into the tent and then they don't really know what will happen, because that's the first stage of the emergency department. When I even capture, there are patients who are doing the swab test, and then the next moment when I turn around and say, can I take more photo of the patient? Then the nurses tell me, they are in a high risk, so we ask them to go to the stage 2, the certain stage. So it's like, this is really serious. It's not just any documentation. It's really important. And in fact, after I do the shoot, we take out the full PPE, clean up all the cameras. The doctors telling me that you sure that you know how to clean your cameras? Do you know how to take out the proper way to take out the full PPE? Initially, I just thought it's so simple, no, just take out. They said no, let's go through the full process. So I get the doctors and the nurses actually beside me to teach me how to do all these things, and I realized that it's a very serious and of course it's a important process to follow all the procedures.
Yeah, there certainly was a lot of important elements to what we all experienced here in Singapore. Miriam, give us your take on how you decided what makes the cut for this exhibition, given the breadth of content you were able to sort of put together.
Yes, so we had 5 photographers and 2 videographers, and there was a huge diversity of material. But we wanted to keep that diversity in the exhibition, looking at so many different communities and how they experienced the pandemic. So we had, for example, children who went to school. We had essential workers, as Bob mentioned. We also had vulnerable communities, social distancing ambassadors, and people who were involved in the general election. When it came to the exhibition itself, to show people this diversity, we decided to organize it into sections. I covered the first 2 sections, which look at a day in the life of people during the pandemic, as well as the essential workers. And then my colleagues carried on into other sections, including the new normal and new spaces in the museum, in society, as well as the people who have been made visible by the pandemic.
And Miriam, as part of all of that, some personal belongings have also been donated by the public. They're going to be on display. What are some of the interesting items that we're going to be able to see?
I think the highlight item would definitely be the vial that was used to contain the vaccine, the very first dose for the healthcare worker in NCID. But most of the other objects were collected through our open call, which is still ongoing. And these involve objects that also tie back into the exhibition. So, for example, items from Catholic High School, items from the general election, and also individual creative responses to the pandemic. One of my personal favorites is a Chinese seal carved by a doctor, so considered an essential worker, but also a practicing artist. And in his seal, he conveys both the difficulty of his job during this time. He calls the seal a smile behind a mask. And he told me the story of how it came from a personal experience of how when he was in the wards, he witnessed a patient who smiled at him, and he realized that he hadn't been smiling that much during the pandemic. And such a simple gesture can actually make a huge difference for both the doctor and the patient alike.
Well, thank you very much for speaking with us this evening, both Miriam and Bob. That's Bob Lee and Miriam Yeoh, Assistant Curator at the National Museum of Singapore.